My name is Bregje van Bon and I'm a clinical geneticist and I work in the Radboud Medical Center in Nijmegen. It's in the Netherlands. In 2010, I was studying for my PhD project. I was trying to discover several causes of rare disorders, and one of these disorders was Schinzel-Giedion syndrome, which is a severe syndrome with multiple congenital anomalies. And this is caused by a really small specific part of the SETBP1 gene, and these DNA changes lead to that SETBP1 will work too hard and then leads to Schinzel-Giedion syndrome. And in the years after that, we discovered that there are also DNA changes which lead to the SETBP1 gene working has less activity, and these DNA changes lead to SETBP1 disorder. And via this Schinzel-Giedion, I roll into this SETBP1 disorder, and then it was Haley who contacted me to ask several questions about the disorder, about what the consequences would be, and also whether I would be like to be on the advisory board of her new organization. What I try to do is, because at the moment, except for the really nice websites Haley created, there's not much information for families and for parents to look into. And especially for health professionals, there is no official document on PubMed, which is a medical database, where SETBP1 disorder is described. And I think that is something that is necessary, because if people want, well, pediatricians or speech therapists, or rehabilitation doctors, if they see a child or an adult with SETBP1 disorder, they want to know what to do and want to know what to expect. And if they want to know it at this time, either they look at the website of the SETBP1 disorder organization, or they have to go through many different papers or medical articles which are online, and there's not much information in there. It's about different topics, and somewhere hidden in the article will be one paragraph about SETBP1, but there is not one main article. And my current main aim is to try to get one article summarizing the medical features of both the existing patients who are described in all these literature, and then add information about novel individuals we came across the last couple of years, and then give an overview of the main features, so that if somebody is diagnosed, there will be a medical official document people can give to their healthcare provider. Well, what I see as a clinician, when people come to me with a young child with a rare disorder, they have lots of questions and they want to know, how is the future going to look like? Will there be other congenital anomalies I have to expect? They get worried because they start Googling and then they see Schinzel-Giedion syndrome, which is a completely different disorder. And my main aim would be that, of course, I can't answer all these questions, but I can answer some of them, and I think a couple of important ones. The main thing is, as a clinician, to give more clarity about the features which people can expect. You want to know what is the spectrum, because there might be children who are really high functioning, but there might also be children who have more problems, and how many people have mild intellectual disability, how many people do not have intellectual disability, and how many people perhaps have a moderate or a severe intellectual disability. Those kind of things. It still won't give an answer about your child, but it will give an answer about the range. And the same goes for developmental milestones. For instance, you might worry if your child doesn't walk when he or she is 3 years of age. But then when you look at the milestones of these 25 people we have in our study, we see that all of them started to walk at some point. So then you might worry less about the motor developmental delay your child is having, and answers to those kind of questions will help a little bit. And by seeing new individuals, every time I learn a little bit more, and every time I can use it the next time. So the first couple of patients I couldn't give much information, but now I can already they're already glad they meet somebody who saw another patient, because the majority of doctors they see never saw somebody with SETBP1 disorder. We try to give an overview. So what is the, like for psychomotor delay, we know many children have a psychomotor delay. What are the milestones of these children? Do we know anything about the amount of intellectual disability? Do we know anything about the speech problems? But I won't go into deep detail of the speech because that's a separate project by Professor Morgan. I want to know whether there are medical problems to expect. A disorder in a child, it's also important for children who have a normal IQ, but just have speech and language or autism or psychiatric problems, that these will also be tested with a similar multiple gene neurodevelopmental panel, because otherwise you might not find some of them, because there are people who don't have an intellectual disability. And of course I'm also involved in the more molecular part of the SETBP1 gene research, because when we know what it's doing, the gene, I know the clinical side, then of course it's also important to know what is the molecular function of SETBP1. Because currently we don't know much about this gene. Why do these children get these features? And it's important to do molecular research. I am a clinician. I can't do this research because I'm just not a lab person. So my aim is to support the organization, but also the parents who want their child to participate in research and bring them in contact with the right people. Like for instance, for the speech study of Dr. Morgan, I supported the Dutch people who wanted to participate, and for the molecular study by the Max Planck Institute, those people who want to be included in this study, I will arrange a muscle biopsy to be taken and send these to the Max Planck Institute. And via this way, I hope to contribute to this molecular research, which I can't do myself. I think it's really great for SETBP1 and is that you, Haley, you've put together so many different experts from different fields. I don't think for many genetic disorders in such a relatively short time, so many different studies started and money has been funded or collected for funding. And by trying to arrange different angles from research, I think that is one of the things one should be excited about, because people now know where to find other families, but also on the research side, different laboratories or hospitals are working together for SETBP1, and I think that's a major achievement and something to be proud of, and also something which gives me hope for the future as well. Yeah, and I also try to look whether there's a difference in severity when you look at the position of the DNA change in the gene, but it doesn't. It's scattered all over, and well, there might be two really close next to each other, and still one is having a moderate intellectual disability, and then the other one is having a normal IQ. So, but they do have speech problems, and autism has somebody with an IQ of about 80 or something, and they still have some developmental problems, but not as severe as some other children. So it's really, yeah, it's a spectrum, and it's not. I think that's also something that is important to realize. People have a DNA change in SETBP1, but they still have 20,000 other genes, and they don't have DNA changes which are similar to the rest of their peer group, and these also have their influence, and also the rest of your genetic heritage is included in a child, which might also lead to different outcomes. Even the same mutation, the same DNA change, if you have a different other genetic background, will lead to different children. And of course, that's also something we see in real life. Everybody is different. Even now we have like 25 or a group of 25 novel individuals. Still, I think I would like to have like 100 or 200, because it's still not enough, but of course you have to start somewhere. And I think the main thing is that they're not alone, that there are more children, and I think that's one of the most important things. And I'm glad for SETBP1 that there is a community, because for many of the rare disorders I see in my clinic, there is nothing on the internet, there is no Facebook page, there is no website, and they are alone. And I can help them with what is available in literature, but I think you parents are the experts. You can help each other because you have been there. I only see people for an hour, 2 hours in the clinic, and then they go again, and sometimes we have mail contact. But you are all the experts, and together you make a really strong community. Even your child has SETBP1 disorder, they are not SETBP1 disorder, if you know what I mean. They have this change, which makes them a bit different from their peers, but they still have so many abilities and things they can go for. But of course, they do have their challenges, and by doing my study, I hope that the community gets aware of these challenges, and that in those will help the supporting medical professionals to help these children in the best optimum way, to give them the best care there is, by giving good education or good medical information. It will help children to get better care, and I think that's my main aim.